Hi, everyone. Welcome to Healthline. I'm Gregory Zarian, and I'm at the Glendale Adventist Therapy and Wellness Center, where their mission is whole person care. Come with me as we go inside and see how they change lives. So joining me right now is the manager of the Therapy and Wellness Center, Kurt Benson. Kurt, how are you today?
I'm great, thank you.
Kurt, being the manager of this amazing facility, what is the mission here at the center?
The mission is to provide state-of-the-art, world-class care and physical therapy in Southern California that can only be gotten in very few places in all of the Southland, and we're one of those premier facilities.
Why are we just one out of many facilities? What makes this facility so special?
Well, it starts off with our state-of-the-art facility.
Okay.
You know, we have 10,000 square feet. It's an amazing facility. There's not a lot of places like this, but the facility itself doesn't make the reputation. The reputation is made by the staff that I have, the physical therapists themselves. They are world-class. They themselves are state-of-the-art. They are fantastic.
And let me throw this out to you as well. You know, there's doctors and there's physical therapists.
Yes.
However, a physical therapist is a doctor, in fact, as well, yes?
Physical therapists have their doctor of physical therapy, and physical therapy as a profession transitioned to the doctorate about a decade ago.
Okay.
So all of my physical therapists that are on staff, in fact, do have their doctorate. Yeah.
Now, being the manager of this awesome facility, what's the one thing you personally have learned about physical rehabilitation and wellness?
That it really is a partnership between the physical therapist and their patient. And if they're not working together, then it's very hard to get people rehabbed. But if the physical therapist can understand what the patient needs and the patient can understand where the physical therapist is coming from, then it's very easy to be successful.
That's fantastic. I say we get on this treadmill and do a mile. What do you say?
Let's go.
Okay. More when we come back. Okay, so we're still here at the Glendale Adventist Physical Therapy and Wellness Center, and joining me is Dr. Matt Hinsey. How are you, Doc?
I'm good. How are you?
Good. Thank you so much for getting on the bike with me.
Hey, no problem.
If I start to sweat. Matt, when someone comes in and you start rehabilitating someone, what is your main mission with that patient?
My main mission with that patient is to find out what exactly they're limited in doing. So if they're, usually I work with athletes, so if they're a baseball player, I find out what position they play, what activities they're having difficulty with during baseball, so that I can watch them do those activities, find out what's limiting them from doing it, and then get them back as soon as we can.
Okay, wait, so specifically, you look at a baseball player and there's a difference from somebody playing first base as third base in regards to their rehabilitation?
Absolutely. The first baseman has less demands for throwing. They have to be able to stretch through their legs versus a third baseman who needs a lot of lateral movement and then a really powerful arm to get the ball across to first base in time to get the runner out.
So bottom line is, when someone comes to meet with you or any other physical therapist, doctor here, you need them to be as specific in regards to everything that they do, even if it's just a man off the street per se. You know, what do they do? Where do they hike? Where do they walk? All that.
Absolutely. The more specific, the better, and the better and faster we're able to help them.
Last question. What is the one thing your patients don't do when they come here that keeps their rehabilitation going a lot slower?
They slack on their exercises at home. We, as part of every program that we do with the patient, they get home exercises that will help them to progress faster. And the best way that you can help your own cause in getting back to the sport or the activities that you want to do is to be consistent with your exercises at home.
Because it's not just going to get healed over here.
Sure. There's a lot of hours in a week, and most patients come here 1 or 2, maybe 3 hours a week. And so doing the right thing for 3 hours a week is not going to get you where you need to be as fast as if you do it more frequently.
So you heard it from Dr. Matt. Be very clear as to everything that you do. Be specific, and it just doesn't get better here. You've got to take your rehabilitation home. More when we come back, and we're going to have a pedal off. Ready?
All right.
1, I'm voting for me. 2, 3, go. Okay, so here I am with Dr. Sheree Tejada, who participates here at the Glendale Venice Physical Therapy and Wellness Center. Doctor, we're on the treadmill. What do you look for in regards to your patients here?
When I'm on the treadmill, I'm looking for where their foot's hitting as they're landing, and
So let's go to that.
Yeah, so
How is my foot hitting as it's landing right now?
hitting with your heel, which is normal a normal gait pattern. And I'm looking for people who are, especially when I'm getting them on here and looking at running.
Okay.
I'm looking if they're a toe runner or a heel runner or a midfoot striker. So those are all different kinds of running. So you see a lot of like barefoot runners hitting with their toes, and that's kind of their stride. So I'm looking at how they run, and I'm looking at from behind, I'm looking at the distance between their feet, if they're crossing over or anything like that. And I'm actually listening to how loud they're hitting on the treadmill, because it gives me an idea of if they're letting their muscles or their joints do the shock absorbing.
So is there a right way to run?
There are a few right ways to run. There's not one right way.
Throw out there a couple right ways to run.
Okay, so I see a lot of people heel striking. That's the most common running pattern. And the right way to do that is to hit with your heel first and kind of progress your weight over, and to allow for a little bit of knee bend as you're running, and to run a little bit more quieter so that you're letting the muscles do the shock absorbing, and they're not taking up that shock in your joints.
So be more intentional with each gait.
Exactly.
Okay.
Exactly.
What is the wrong way to run?
Well, if you're not getting a lot of hip mobility, or you're not letting your knees accept the weight and attenuate the shock, that's when you get the loud running.
Okay.
And people who are stomping, and then you get the joint pain.
Okay.
So that's the wrong way to run.
So let's speed this up a little bit, and if you could tell me if I'm running the right way. Okay, are we ready? Here we go.
Ready?
I am. Okay. So does every patient come to the wellness center? Do they have to go through the treadmill, or is it just specifically for runners?
It's specifically for people who... I usually use the treadmill specifically for people who have pain running.
Okay.
I use it for an older population for walking if they're having difficulty with that. Is that speed okay for you?
That is fantastic.
Okay, so I'm going to take a look at what's going on here.
Okay, we're going to give me a critique right now. Couple things. Don't do this at home, and preferably don't wear a suit. So how am I doing, Doc?
Okay, I'm going to slow you down so you can...
Please.
Okay. I actually think your running looks pretty good, considering you are not dressed for running. But you get a little bit more forward trunk lean than I would like, so you're kind of here a little bit more, which doesn't allow you to utilize both your anterior and posterior muscles as well. Yeah, so a little bit more upright, not as far forward. You're still going to be leaning forward a little bit, but you're hitting with your heel. You run fairly quietly, especially since you're not in sneakers, and you are lacking a little bit of hip extension. Okay. So nothing too bad.
Three, 2, 1. Here, Janice, go ahead. Check me. Oh! We're not going to get nothing done today. Oh! We are back at Glendale Venice Therapy and Wellness Center, and I am with manager Kurt Benson. How are you, Kurt?
We're doing great. Thank you very much.
Good shot, right? Yeah. Oh, come on. So we also had Matt with me on the bike. So Dr. Sheree running, Dr. Matt on the bike, sports medicine. What other types of physical therapists do you have here?
Well, we don't just treat athletes here.
Okay.
We also treat people that are older. Geriatrics is one of our specialties.
Okay.
We also treat the pediatric age.
Okay.
So the young athlete all the way to the weekend warrior, the boot camp, person like yourself.
Okay.
Another area of specialty we have is we treat people with jaw problems.
Okay.
TMJ.
TMJ, okay.
Exactly. Yeah. Lymphedema, excessive swelling in the arms or legs.
Okay, so that has a name, lymphedema.
Yes.
You also treat musicians.
And we treat musicians. Yeah. Musicians have often repetitive strain injuries because they are playing repetitively over and over and over. And I have a therapist that specially treats these type of injuries with musicians.
Because they're in the same position. Do you also treat people that sit at a desk like this for hours too?
Yes, all the time.
And that's called?
Ergonomics.
Okay.
Yeah.
I was going to say like office worker,
Yes.
ouch therapy. We also have two therapists. Let me bring in some of your superstars. We have Dr. Jeff and Dr. Janice. Jeff, what do you specialize in?
Well, among other things, I specialize in sports and manual therapy.
Oh, we're going to do this over because you're my co-host. Dr. Jeff, what do you specialize in again?
Well, among other things, I specialize in sports and manual therapy.
Okay.
Yeah, so that includes athletes and just people with stiff joints, stiff muscles in general.
And when you say manual, that means you actually are tactile with the patient. You go in there.
So that's the slice of therapy where we're actually, we have hands-on interaction versus like, movement analysis or therapeutic exercises.
Okay, so since my knees are a little bit sore from boot camp and I've had 2 meniscal tears, can I see what manual therapy is all about?
Yeah, we'll check you out and see if you need any.
That's fantastic. And Dr. Janice, what do you do?
So I specialize in musicians. And so I was a former professional musician myself before I got into physical therapy. And so I took my background and I kind of helped people who had the similar problems that I did, where before I couldn't play, so I went through therapy and rehab, and having someone who understands like the background and what is required to play, to really help them get back. Just like with athletes, you want to get back to playing on the field, so we need to get them back on stage and keep on playing.
What instrument is your specialty?
Piano and violin, those are my two specialties.
I play both.
Well, perfect.
Yeah, I'm accomplished in both. I am. Okay, so when we come back, you're going to see me play piano. You're going to see me do the theme to Young and the Restless on violin. And Dr. Jeff is going to work on my knees. And thank you to the best co-host ever. Kurt, thank you so much. And I'm going to try to go for one more hook shot. Ready? 2. Oh, come on. Who moved the basket? Don't go away more when we come back. Okay, welcome back. Here we are in the boot camp exercise room, and joining me are Dr. Janice and Dr. Jeff. Jeff will be my co-host. We passed on Kurt. We got rid of Kurt as a co-host, and now we have Jeff. So Janice, you specialize in physical therapy of musicians. Explain that a little bit more.
So I treat musicians, all different instruments. My two instruments that I performed on were violin and piano, but my background covers all different instruments. So I've seen guitarists and drummers and trombonists and violinists. Kind of covers the whole spectrum. And so typically what I do is I take a look, if they have pain with playing, then I look at their playing position and kind of see if there's anything in the way they're sitting or the way that they're carrying themselves that might add to more injury down the line.
And this is also great for you because you personally play them.
Right.
It's kind of like the actor that becomes a director.
Exactly.
He knows exactly.
So yeah, I mean, we share the same lingo. You don't have to take a lot of time explaining.
And you also know what you're looking for.
Right, having been there myself.
Okay, so set me up. So,
Okay.
you know, I am a concert violinist. Okay.
So this is a violin. So
Yes.
you're gonna hold it here, and then this is gonna go right on your shoulder.
Okay.
Like this.
Okay.
Okay. Very good. And then this is your bow. You're gonna hold it in your right hand.
Okay.
So what I look for is the alignment, is if the person is bending their neck too much. I don't know if you can feel, but in order to hold the violin, you have to hold it mostly with your chin and your shoulder. This hand needs to be free enough to move.
Okay.
And so if people aren't holding it in the right position or they're in bad alignment, they could lead to chronic stress, overuse syndromes of the shoulder or of the forearm here. So when I usually take a look, I take videos from all different angles while they play, and then try and look at their angles, alignments, kind of like what we do for running analysis. but in a different activity.
It really is, though, all about alignment, because if you're sitting like this for an 8-hour concert per se,
Right.
5 days a week, you're going to get stuck and your body gets stagnant, and 9 times out of 10, people don't stretch out of
Exactly.
out
So,
of their position.
I mean, you usually are playing, if a professional musician is playing, you're probably playing for maybe like 2-3 hours, maybe 4 hours max at a time. And that's with like breaks in between. But these people are also rehearsing and they're spending their own personal time practicing. So
it could equal out to 5, 6,
it
7, 8 hours a
it
day.
could very easily equal out to 5-6 hours, but kind of interspersed throughout the day. And so teaching them good techniques to take the pressure off or changing positions, taking breaks is a really important thing. So just educating them on how they can prevent having the pain come back. It's beautiful. Carnegie Hallways.
So, thank you. Dr. Jeff, what is up with the mirrors?
Well, we have mirrors kind of all over our facility here. One of the main roles that they play is they provide visual feedback to the patient. So, if you're trying to achieve a certain position or a certain movement, for example, playing the violin, Janice will kind of give you cues about positioning and which way to move to be optimal, with your movement. And so we know what's going on, but it's necessary that you, the patient, knows what's going on as well. So we have these mirrors to provide some of that visual feedback, in addition to kind of like the tactile cues that she'll give to you.
So everything, though, like even within the mirror, since we're being filmed in the mirror, everything is all about proper alignment. Everything is all about, like if you're working out at the gym and you're doing this, that's wrong, instead of dropping your shoulders and doing it from the elbows tight in and doing everything properly.
Right, yeah. So
And it's as simple as teaching somebody how to, do you use these mirrors to teach people how to walk properly as well?
Yeah, we do that too, yeah.
That's fantastic. Okay, well, you just witnessed my first concert. Please feel free to find me on iTunes. And Dr. Jeff is going to show me a little bit about manual therapy, and my new co-host, Janice, will be asking some questions. Do not go away. We'll see you in a second. Okay, so we just left boot camp exercise room where Dr. Janice, performing arts therapist, shared with us what to do if you have an injury, if you play violin, piano, all of that. Welcome back, Dr. Janice.
Thank you.
And joining us now is Dr. Jeff. He's a manual therapist. Dr. Jeff, what does that mean?
Well, to be a manual physical therapist, it's just a slice of what physical therapists do in general.
Okay.
And the manual part refers to the hands-on part of the therapy. So that's in addition to the therapeutic exercise. That's in addition to the movement analysis.
It doesn't mean massage therapist.
No, it's a little bit broader than that. Like
Okay.
it could mean that we're trying to provide more mobility and flexibility to soft tissues like muscles, or it could also mean that we're trying to provide more mobility to joints. So kind of restoring joint range of motion and things of that nature.
Okay, last year I had a meniscal surgery on my left knee. My joints are sore. So, Dr. Jeff, what do I do? Let's
Go ahead and lay down.
Okay, let's treat me.
I mean, again, first we kind of look at to see if there's any flexibility issues
Okay.
in the knee, and if there is, then there might be a need for stretching exercises or
Okay.
manual therapy.
So, Dr. Jeff, what are you looking for?
Well, first we'll kind of examine the knee range of motion. So
Okay.
we see, we want to look if your knee has full extension,
Okay.
and it looks like you do.
Okay, great.
No problems there. I want to see if you have full knee flexion, if you can kind of get your heel to your butt. You just about do.
So is that good?
Yeah. So
Okay.
your range of motion in the knee is fine, and I mean in that case, there's not any particular manual therapy indicated for the joint of the knee.
But just say there was, what would you be doing?
Okay. Well, we would do manual stretches. So if your joint in fact was stiff, then there are various things we could do to try to stretch it out and get more mobility in there.
Okay.
So it'd be various stretches depending on which angle you're lacking in that flexibility. We'll work and improve that.
So someone comes here, someone sees you, Dr. Janice, someone sees you. Do people assume that just because they're on this table or just because they're in your chair, that it's a cure-all and they don't have to take this and do it at home? Because I'm sure you get stretches and homework.
Yeah, there's totally homework involved. We supplement what we do in here with homework with what the patient does. So,
Okay.
It's kind of like their responsibility. If you go to the dentist and they kind of clean things up for you, it's like, well, you still got to go home and brush your teeth. So it's kind of the same principle.
Got it. So bottom line is your own physical therapy is in your hands, and it becomes a team.
Absolutely.
Right. Yeah, it's a collaborative effort for sure.
Yeah.
Go ahead. Dr.
Oh, no, that's exactly something that I tell my patients all the time is like, we do our part here, but it's up to them to, keep up. So, for example, if the knee is lacking range of motion, we might get 20 degrees more, but if they don't do anything to follow up with that, then their knee's going to become stiff again, and they wonder why. It's like, well, you didn't do much in between when I saw you two days ago or 3 days ago to now, so the knee's going to become stiff again unless you do something to help reinforce what we do in therapy.
And you don't wake up and it's not a cure-all. Final thoughts on this, Dr. Jeff?
Manual therapy is kind of one of the, just again, a small slice of what we're able to do here to kind of look at the whole person and their health in general. And I think you guys covered it in previous filmings where you talked to Dr. Matt, Dr. Shrey about running, movement, exercise, all that good stuff.
And bottom line is everything is all about alignment. So here's the deal. If you or someone you love needs a physical therapist, all you have to do is pick up the phone and call
323-255-5409.
and come join the amazing staff, the awesome doctors at Glendale Adventist Medical Center Therapy and Wellness Center. Remember, the most important conversation you're going to have is the one about your health. So why not have it now? Do you want to go back and play some more basketball?
Let's go.
I'm going to take him down. We'll see you next time. Come on, co-host.